On this Sunday night, the worsening situation in Canada's COVID-19 hotspots. The crisis in Alberta.
There's lots of metrics in Alberta that are headed in the wrong direction.
But there's a battle over tougher restrictions. The pandemic forecast in Quebec.
The worst months of the pandemic may actually be in front of us.
The winter of our COVID discontent. Plus the pandemic and property, while real estate is hot. And the asteroid mission to space and back in 6 years.
Global National with Robin Gill.
Good evening and thank you for joining us. It's been weeks since Canada's hardest hit provinces tightened up measures to try to curb the spread of COVID-19. But the virus is still running rampant. Take a look at the rate of infection over the last 7 days across the country. Alberta shows the biggest concern. Its rate is more than twice as high as Quebec and over 3 times higher than Ontario. Today, Alberta once again recorded over 1,800 new cases. As Abigail Bimman reports, there are calls for stricter measures, but some Albertans are protesting the ones already in place.
This is Christmas. This probably won't be the only virtual Christmas performance you watch in 2020. But this one comes with a message. COVID is real. It affects all of us. A life or death message for Mike Brazeau, whose wife Michelle just came off a ventilator, struggling with COVID. The Alberta man wasn't up to doing an interview, still waiting to speak to her. But his message could use some amplifying.
Are you concerned about the virus at all?
No.
Why not?
Because it's not real.
This weekend, hundreds of people protested new COVID-19 restrictions in Alberta, a handful sporting jackets of the far-right extremist group Proud Boys.
My children miss school, they miss their friends, but they can't breathe in masks, and I'm their advocate.
The Justice Centre for Constitutional Freedoms has launched a new court challenge against the province.
And the lockdown measures are illegal under the Charter.
Premier Jason Kenney called the gathering irresponsible, tweeting, "While there are charter-protected rights in Canada, we also have responsibilities as citizens."
Certainly, there's lots of metrics in Alberta that are headed in the wrong direction.
Alberta has extremely high case numbers, with the test positivity rate topping 10% Friday, ICUs over capacity, and a call this week to conserve oxygen in hospitals due to the expected increase in demand.
I just don't think we have more time to wait. I think this week we absolutely need strong restrictive measures implemented.
Imposing mandatory restrictions on social gatherings in people's homes, where we really saw that as the main concern.
On the West Block with Mercedes Stephenson, Alberta's health minister pushed back against criticisms his province isn't doing enough.
We want to see our R rate come down below 1. We haven't seen that yet at this time, and so it is the case that we might be imposing further measures. We're going to be reviewing that data with our public health officials, though, before December 15th.
The R rate refers to the average number of people infected by each case. Experts across the country want it to be lower than 1. Alberta's government promised to make the current rate public by now, but hasn't done that since November 22nd. As for any future measures, the Premier said they would likely be targeted at Calgary and Edmonton and not rural communities with fewer cases. Abigail Bimman, Global News, Ottawa.
After shattering the record for cases in a single day on Saturday, today Quebec reached another stark statistic. The province surpassed 150,000 COVID-19 cases since the pandemic began. That's the most in Canada. And as Mike Armstrong reports, there are predictions the crisis will just get worse.
They're calling it a last resort. The Regional Health Board for Montreal's West Island is telling West Islanders to stay away from their local hospital. The board says the Lakeshore General has had COVID-19 outbreaks in several departments, and its emergency ward is considerably over capacity at 132%. Now, this is exactly what health officials are trying to avoid, overwhelming the system. Basically, every measure or restriction put on the public has been about protecting the ability of hospitals to treat patients.
Things are not getting better.
This epidemiologist says a tighter lockdown may be needed. Already, the virus is spreading too quickly. The focus shouldn't just be the current situation, he says, but what's coming.
We are just getting into the winter. The worst months of the pandemic may actually be in front of us.
The date that has the Premier nervous is December 25th, Christmas. What happens if families get together for the holidays? François Legault had said he'd decide whether to allow gatherings for Christmas December 11th. He didn't wait that long. This was Thursday.
I'm announcing that gatherings in red zones won't be allowed for Christmas.
Now, the province is also worried about people shopping for the holidays. It brought in new rules as of Friday. Across the board, stores and shopping centers are only allowed 20% capacity.
Everyone has to do exactly the same, and this is mandatory.
Businesses caught not following the rules can face fines or even be closed. The rules also apply to shoppers. Patrons can be fined. Police in Laval, north of Montreal, posted this photo this weekend to say they're out and watching. Mike Armstrong, Global News, Montreal.
For the first time, Ontario is reporting more than 1,900 new cases of COVID-19. It's the second straight day of record-breaking numbers. Much of the Greater Toronto Area is locked down, but one region is still open, and people are heading to malls there to do their Christmas shopping. As Morgan Campbell reports, the medical community worries that may push the caseload and stress the healthcare system even more than it already has.
Shoppers turned out in droves Sunday, lining up to enter Vaughan Mills Outlet Mall just north of Toronto.
I tried to go in Bath and Body Works, and the line was ridiculous. Wrap around the food court twice.
The mall has been crazy. I'm surprised at how busy it is actually, but we just quickly came in for a few offers and now we're heading home.
Home is exactly where medical professionals say people in most parts of the Greater Toronto Area should be, as the province continues to see a spike in new COVID-19 cases. Ontario continues to smash records for the second day in a row, reporting nearly 2,000 new cases of the novel coronavirus. And while those statistics are concerning, experts say lockdown measures, although controversial, seem to be working.
I think it would really be a tragedy. It would be, with projections where 20,000 people a day. I mean, there's no way we cope with that.
Starting Monday, in all Toronto public and Catholic schools, a new stricter screening process will be in place. It involves a number of measures, including if a student has even one symptom of the virus, everyone in their household must stay home for 10 days. This follows numerous outbreak investigations in two of the country's largest school boards. It is a move this mother can get behind.
It makes sense. So I support that aspect of it. It's just going to be probably a lot more kids not being in class.
Medical experts say it is just one more layer of protection for those within a school community.
Talking about any new onset symptoms, and parents know when a kid's sick, even if it's minor. I think it's the right thing to do.
And while the province deals with the largest single-day increase to date, residents are trying to cling to some kind of normalcy, a holiday season that somewhat resembles years past.
If you have to take the extra precautions to stand in line, then so be it.
Morgan Campbell, Global News.
Today, a bit of good news out of New Brunswick. The province is moving Fredericton and Moncton back into the less restrictive yellow phase at midnight. The chief medical officer credits residents following the rules and bringing numbers down. In the U.S., the White House says the worst days of the COVID-19 pandemic are still ahead. A special committee is set to approve a vaccine on Thursday. First responders and residents in long-term care homes are the first priority. The general public could start getting the shots in the spring. As Jennifer Johnson reports, the vaccine can't come soon enough to stop the latest surge in deaths and hospitalizations.
Federal health officials are calling on Americans to stay vigilant as they race to roll out a COVID-19 vaccine.
We're going to focus on those most vulnerable and those most on the front lines of treating people with COVID with the initial 40 million doses in the next month.
A Food and Drug Administration advisory group will vote Thursday to give emergency use authorization for the Pfizer vaccine. If approved, millions of doses will then be fast-tracked to each state.
Within, I would say, 36 hours from approval, potentially the first immunization could be taking place.
Officials say general population vaccinations could begin by April in a race to stop a virus that's killing about 2,000 Americans a day.
The vaccine's critical, but it's not going to save us from this current surge. Only we can save us from this current surge.
Dr. Birx and others are frustrated so many Americans still refuse to physically distance or wear masks, and calling out state leaders for not doing enough.
We have governors and mayors who have cases equivalent to what they had in the summertime, yet aren't putting in the same policies and mitigations that they put in the summer.
Some governors are making unpopular decisions. Starting Sunday night in California, a stricter, more widespread stay-at-home order goes into effect as ICU beds become scarce.
People's jobs, their businesses, their livelihoods are at stake. This is going to be painful.
I think this is going to be the nail in the coffin of a lot of restaurants here in San Francisco.
Trump administration doctors plan to brief the Biden transition team this week after the president-elect questioned whether there was a plan to properly administer the vaccines, since some require ultra-cold refrigeration. Jennifer Johnson, Global News, Washington.
Masks and social distancing were not required for President Donald Trump's tightly packed rally in Georgia.
We're fighting very hard for this state when you look at all of the corruption and all of the problems having to do with this election.
Trump touted more baseless claims about election fraud. He was in Georgia campaigning for two Republican candidates running in a Senate runoff. Democrat Joe Biden won Georgia in the presidential election, but the two state Senate races did not result in a winner. A special election will be held next month, and it is key for both parties. It will decide who controls the Senate after Biden's inauguration.
We have a big senatorial race going on in Georgia, and we are watching Democrats very, very closely. And remember this, we had this massive race all over the country, so they could cheat in Georgia, and people aren't really watching it like they should.
In another development, the president says his personal lawyer, Rudy Giuliani, has tested positive for COVID-19. He's the latest in Trump's inner circle who have contracted the novel coronavirus. It's not clear if Giuliani is experiencing any symptoms, but at 76 years old, he is considered high risk. A new study may have found the cause of the mysterious Havana syndrome. The report by the U.S. National Academy of Sciences says directed pulsed radio frequency energy appears to be the most plausible explanation. In 2016, dozens of American and Canadian embassy staff in Cuba started getting sick. Their symptoms included hearing loss, nausea, headaches, and dizziness. Many still continue to experience those symptoms or have other health problems. COVID-19 restrictions have limited the annual memorial for the women killed in the Montreal Massacre. A small crowd gathered in person to lay flowers at a park honoring those who lost their lives in the mass shooting at École Polytechnique 31 years ago today. Other commemorations are happening virtually. The anti-feminist attack on the engineering school was one of the deadliest mass shootings in Canadian history. On December 6, 1989, a gunman stormed into a classroom, ordering all of the men out, then opening fire on the women remaining inside. He then roamed the school, shooting and stabbing more women before killing himself. In just 20 minutes, he killed 14 women and injured more than a dozen. Coming up, why recreational property is so popular during a pandemic, and the 6-year mission to gather asteroid dust, why it's so important. COVID-19 has caused a big slowdown in the global economy, but there's one sector that has surprised many and come out strong: Canadian real estate. Some analysts say the pandemic is pushing sales, and as Ross Lord reports, the prices are soaring beyond the big cities.
At a time when the only constant is change, there's a big shift in the Canadian real estate industry.
Real estate is one of those sectors that has actually seen what I call a COVID catalyst. Maybe the 3 Ps of the pandemic: puppies, Peloton, and property.
Home prices are up about 10% this year. And your report says cottage country, known as the recreational market, is especially hot. By the end of September, year-over-year home prices in recreational property increased by 11.5% to an average of $450,000. Waterfront housing is even hotter, with prices increasing by 13.5% to an average of almost $500,000.
You see people saying, you know, my job can be done from anywhere. I'm making that decision. So potentially I'm going to relocate my family to a place where the cost of living is less and the quality of life might be better for me.
Questions about a home's internet speed are now a priority. Royal LePage reports more than half of new buyers are looking at recreational properties as full-time homes. Exactly the thinking with this cottage in Falcon Lake, Manitoba, near the Ontario border.
We actually were looking at moving our home in the city, and when this thing came up, we were like, no, we'll buy this instead.
Some of the increase is pent-up demand from the spring lockdown that paralyzed real estate. In Atlantic Canada, long considered the best real estate deal in the country, there are far more buyers than sellers. As a result, the cost is skyrocketing.
Even I was shocked at the price. It was, almost $200,000 over the asking price.
Royal LePage doesn't see the trend letting up. It's forecasting demand and prices for recreational properties will keep increasing in the new year. Ross Lord, Global News.
Still ahead, why are COVID-19 deaths so low on the vulnerable continent?
And we can see a lot of stars.
Japan's space agency has a lot to celebrate after ending a 6-year mission. The unmanned Hayabusa 2 spacecraft passed by Earth today, dropping off a capsule of samples from an asteroid that will help study the solar system's origins. The capsule landed in Australia. The probe is now headed toward another asteroid that could take another 10 years to reach. More than 1.5 million people around the world have died from COVID-19 since the pandemic began. About half of those have been in North America and Europe. So far, only about 53,000 deaths have been recorded in Africa. Researchers are still unsure why the number is so low, but it could be a vast underestimation of the true figure. And as the world starts distributing vaccines, countries across Africa are asking not to be left behind. Redmond Shannon reports.
For people fleeing Islamist violence in Burkina Faso, social distancing is far down the list of priorities. This aid worker says you can't avoid contact when helping people. And for many of the 1 billion people across the continent of Africa, close contact is a part of life. So why does the COVID death rate appear to be so low?
The two most important factors are age and the presence of comorbidities. And we found ourselves in a continent where these two are lower compared to what you find elsewhere.
More developed nations like South Africa and Morocco record more cases and deaths, suggesting that a lack of testing and monitoring could also explain what's going on. A new study of data in Sudan's capital, Khartoum, says deaths could be more than 20 times higher than official figures.
The case fatality ratio, as it's spaced across ages, appears to be similar to case fatality ratios we're seeing from other hospitals in the world.
It estimates more than 35% of residents have already been infected. The World Health Organization says COVID-19 may impede the treatment of other diseases like malaria and HIV/AIDS, potentially adding more indirect deaths than those coming directly from the pandemic.
Partly lockdowns. People who couldn't move. Another reason is the issue of accessibility because of logistics, a closure of borders.
Some countries are using the experience of epidemics like Ebola to educate, to monitor, and soon to vaccinate.
The next thing is actually getting the vaccine distributed to your country. And then thirdly, it's setting up the logistics and distribution channels and storage and other things within your own country. So it's a huge undertaking.
Canada is among dozens of richer nations that have committed to fund COVAX, a program to quickly distribute affordable COVID-19 vaccines in developing countries. The United States and Russia are not part of that plan. Redmond Shannon, Global News, London.
The Oxford team behind the AstraZeneca vaccine is making progress on a potential malaria vaccine. The vaccine is about to enter the final stage of human trials. It'll be tested on 4,800 children in Africa next year. If all goes well, the vaccine could be in use by 2024. Malaria is a mosquito-borne infectious disease. It's treatable with drugs, but a vaccine could prevent up to 500,000 malaria-related deaths each year. Up next, the Canadian Friends star who's using fashion to fight the pandemic. Chandler can't dance, but he can make a t-shirt. Canadian actor Matthew Perry has launched a limited edition clothing collection inspired by Friends, the hit TV show he's known for. All the proceeds will go to the World Health Organization's COVID-19 relief efforts. In response, the WHO tweeted, "We are more than friends, we are family." We told you about the Vancouver Canucks parting ways with their longtime anthem singer over his involvement in a rally against COVID-19 restrictions. Well, that story garnered lots of attention on social media, but there was one unintended consequence. The team's owner revealed he was firing Mark Donnelly in a tweet Friday night ahead of the singer's appearance at the protest in downtown Vancouver yesterday. Twitter was inundated with reaction, except it was a different Mark Donnelly bearing the brunt of it all. A British sports writer who says he has received well over 1,000 misdirected tweets.
It's been, a little bit strange. Certainly at first thinking, what have I done here? Why am I getting all these messages? And then realising, obviously, they weren't intended for me. But there's been a lot of really nice messages as well of obviously people from Vancouver being really apologetic that I've kind of been caught up in all of this and being very, very nice and very, very kind about it all, which is really, really nice to see.
He also cleared up any confusion about the differences between him and the other Mark Donnelly, saying on Twitter, "Yes, I wear a mask and advocate everyone doing so. No, I can't sing. No, I can't skate. Yes, I promise I'm not actually a 60-year-old anthem singer masquerading as a journalist." And that is Global National for this Sunday. I'm Robin Gill. Tonight, your Canada is Bird River, Manitoba. Thank you for watching. Donna Friesen will be back tomorrow. Have a great night.